day everyone, I am Fermil PASGALA of BSN 2-5 of Our Lady of Fatima University, and I'll be performing a return demonstration regarding postpartum assessment from head to toe using bubble heat technique, and that includes the breast, uterus, bladder, bowel, lochia, episiotomy, Homan signs, and also the emotional health of the patient. But before we proceed, we must do a proper hand washing and hand gloving, identify ourselves to the patient, explain the procedure to the patient, and provide privacy to our patient. And after that, we may now proceed to the next steps of the assessment. Good day, ma'am. I am student nurse Fermil, and I'll be doing the assessment today for you, ma'am. So, ma'am, can I check for your wristband, ma'am? Can you state your name and birthday for me, please? Okay, ma'am. So, ma'am Yuna Garcia. Ma'am Yuna, I'll be doing a postpartum assessment. It includes the bubble heat technique. And this procedure requires me to touch your breast and other parts of your body, ma'am. So is it okay, ma'am? Okay. So, ma'am, first I'll be checking for your vital signs and your temperature, ma'am, okay? Okay, so for the patient's blood pressure, it is 120/80, which is normal. And for the patient's temperature, it is 36.5, which is normal. Now, ma'am, I'll be proceeding to the assessment. So, for the first assessment, it is your breast, ma'am. I'll be touching your breast. Is it okay, ma'am? So for the assessment of the breast, the patient's breast is normal. It has no signs of redness, no bruises, cracks, and dryness. The nipples of both breasts are everted, which is normal. So for the next procedure, I'll be assessing the uterus. I'll be using this other hand to support the bottom of the uterus and this other hand to the whole assessment. Ma'am, I'll be assessing your uterus, ma'am. For the patient's fundus, it is also normal. So for the next assessment is the bladder. Ma'am, I'll be asking some question. So ma'am, when was the last time did you go to the bathroom? Okay, so 30 minutes ago, ma'am. So ma'am, I'll be encouraging you to go to the bathroom every 2 to 3 hours to eliminate fluids from your body. It will benefit you from not filling up your bladder, and also it also includes the benefits of bleeding less, healing faster, and receiving less pain, ma'am. Okay. So after that, the next assessment is for the bowel. Ma'am, I'll be auscultating your tummy, ma'am, okay? symptoms are normal. Now, I'm going to ask the patient regarding their last time of eating and drinking. So, ma'am, when was the last time did you eat and drink? Breakfast and dinner. Okay, ma'am. So, ma'am, I'll be encouraging you to take foods that are high and rich in proteins, such as fruits, vegetables, and grains. This may help you to become stronger. Your body needs proteins and calories that may help you from getting better, ma'am. So, in regards that you are a newly delivered patient, you should take foods that are rich in proteins. Next is I'll be assessing the lochia. So, ma'am, I'll be checking for your lochia, ma'am, or your discharge. So, is it okay for me, ma'am, to remove your underwear? Okay. So, the patient's discharge is bright red color. It has not a lot of blood. So, I'll be asking the patient when was the last time did she change her pads. Ma'am, when was the last time did you change your pads? 35 minutes ago, ma'am. Okay, ma'am. So, ma'am, I'll be encouraging you to go to the bathroom as what I have said, 2 to 3 hours. You should always eliminate fluids from your body and also check for your pads. Because you are a newly delivered patient, you are risk in infection. So, even though you don't have a lot of discharge, you should always change your pads to prevent infections, ma'am. Okay, ma'am. So, for the next assessment is the episiotomy of the patient. Ma'am, I'll be checking for your episiotomy. I'll be removing your underwear and check for your episiotomy. Okay, for the patient's episiotomy shows no any signs of deviations. It has the normal redness, edema, slight edema, some bruises in laceration from a episiotomy, which is very expected and normal, and also the stitches are approximated. So for the next assessment is the Homan sign. So, ma'am, I'll be checking for your Homan sign. So, ma'am, please relax your legs, okay? So, ma'am, tell me if you feel any pain or okay. Do you feel any pain, ma'am? Okay. So, ma'am, I'll be checking if it is inflamed, okay? Okay, it is not inflamed. So, for the patient's Homan signs, it is normal. There's no signs of swelling and redness. So, the patient is normal. So, for the last assessment for this procedure, it is assessing for the emotional status of the patient. So, regarding the emotional status of the patient, I'll be using 3 stages, which are the taking in, taking hold, and letting go. Since my patient just gave birth to a baby, I can assess that my patient is in the taking hold stage. She is very interested to her baby and she has also support from her husband and her family. Overall, she is in a normal emotional status. Okay, ma'am, that would be all. And thank you for cooperating. And ma'am, I'll be encouraging you to call me whenever you need help and whenever you want to see your baby, I may help you in that matter. Okay, ma'am? Okay, ma'am. Thank you for cooperating.